Caucus members and speakers to please come forward so we can get started. And even if you're not a speaker, some of our stakeholders, please come up. We'd love to have you in our press event. Thank you so very much. Okay, we're going to start the run of show off with our good senator from Los Angeles, Senator Maria Elena Durazo.
Good morning. Thank you all for joining us today. We stand together at a very critical moment for our California values. I want to thank our Latino Caucus Chair, Gonzalez, our vice chairs, leaders of our various committees who are here with us today, all together at this critical moment. Last week, Governor Newsom proposed unprecedented changes to Medi-Cal coverage for undocumented Californians, imposing a pricing policy on health care based solely on President Trump's definition of legitimate residency in California. This proposal is health care redlining, imposed on one group of California taxpayers, a group that pays $8 billion in taxes. Our immigrant communities work in essential industries that power our economy: construction, agriculture, hospitality, childcare, domestic services, and more. The governor is proposing a troubling precedent, raising prices on one group of Californians based solely on their immigration status. It is illegal for Kaiser to do this. It is illegal for United Healthcare to do this. It is illegal for any doctor, hospital, or clinic to charge higher prices to undocumented customers. It is illegal in car insurance, workers' compensation insurance, homeowners insurance. It is illegal for any business. Governor Newsom is proposing that California be the exception, the only insurance provider for whom such discriminatory pricing is legal. We must ask, what's next? Will landlords be allowed to charge them higher rents? Will other services adopt similar discriminatory pricing? We all know we don't have enough money for everything we want in our society, but we are all smart enough to find equitable ways of dealing with it. Governor Newsom, we ask you, rethink this mistake. Redlining was a shameful reality in California's past. Let's not go back there. Now I'd like to introduce the chair of the Senate Health Committee, Senator Menjivar.
Gracias, amiga. Thank you, Senator. If you were to remove the name from this document, you would remove the state, and people would just read this off to you, you close your eyes, you would think, oh, that's a budget proposed by a Republican in perhaps Alabama, if you were just to read it. Because that's what it feels like. A direct attack from Republican talking points, and this is personal to me. I'm not just here as the chair of Senate Health. I'm here as the hija of Salvadoran immigrants, the niece of TPS holders, the niece of undocumented individuals, the daughter of a mother on Medi-Cal, because this is a personal attack on my family and the family members that you see surrounding us here in support. What is happening is that the rhetoric, what they want you to believe is that our community is at fault for the deficit in our state's budget, but it's not. What is happening year after year after year is that entities, businesses are getting away with providing a less than livable wage, or getting away with forcing their employees to have a part-time schedule, forcing them into our state's driven Medi-Cal program. In fact, we, the state, are subsidizing corporations and employees in providing them, their employees, health insurance, instead of saying, hey, you, enough. You need to provide a work schedule to your employees that puts them at full time, that pushes them out of Medi-Cal, that gives them a livable wage, that pushes them out of Medi-Cal and off of the state of California subsidizing them. And another point, let's not pretend that this is, oh, out of nowhere we expanded, this is the fault to the deficit. We've been providing long-term care for the undocumented individual for 20 plus years. In fact, the state of California has known that the federal government has given them the option to remove long-term care for individuals over 20 years ago. All of a sudden, now it's a problem? We complain and talk about the unhoused individuals on the street, and our solution is to push people out of skilled nursing facilities with nowhere to go. Make no mistake, we are going to be the problem to unhousing individuals. We're pushing people on the streets and then saying, okay, you're going to lose your housing. Oh, and by the way, if you want help, it's $100 a month. Over the weekend, tens of people that I was talking to in clinics said, this is going to hurt us. So I'm standing with our allies and our colleagues to say, Governor Newsom, this is not the solution. There are other ways. We're saying no to these Medi-Cal cuts. And to that, I'd like to now introduce my sister in arms on the other side, the Assemblymember Chair in Health, Mia Bonta.
No, let's go to the next one. Oh, it's me. It's me. Okay, we'll come back to Assemblymember Mia Bonta, but I am so very proud of this caucus. I'm the chair of the Latino Caucus that consists of 38 members, 35 legislators, 3 constitutional statewide elected officers, and we represent, just to mention to everyone here and to remind everyone, we represent every corner of this Golden State, every single corner. Many of us, as been mentioned by Senator Menjivar, are either immigrants ourselves, daughters and sons. We have folks in our communities, in our own families that are receiving Medi-Cal. And most of them, overwhelmingly, are working people. They are hardworking community members. And we're here today because we believe that access to healthcare is a basic human right. And that when we fight for healthcare for hardworking immigrant families, we're fighting for all Californians, because when our neighbors are healthy, our entire community thrives. We should know that. And I don't know why, it's pretty exhausting to have to come up here time after time to time and provide the value in numbers of what the immigrant community provides to this great state and this nation. Nationwide, providing nearly $100 billion in federal, state, and local taxes. We pay into the Social Security system and into unemployment insurance. We pay into payroll taxes. We pay into this great California state that we call and we love. They contribute right now over $750 billion of our GDP, 32% in California they contribute. And they are 43% of our construction workers, literally rebuilding Los Angeles after the fires as we speak. And yet they get little to nothing in return. Everyone asks, industry asks us, what's our return on investment? Well, I ask industry and I ask all of you, what is the immigrant community's return on investment? They have provided nearly $9 billion in state taxes to our coffers. And what is their return on investment? Shutting them out of healthcare, a basic right? We're okay saying that we're the 4th largest economy. We're okay saying that. But who are we the 4th largest economy on? Who are we on the backs of? It is immigrant communities. It is the folks that look like us that are standing back here. And when we provide access to healthcare, we reduce the ER visits, improve health outcomes, and save millions of dollars a year. It's really easy. Food, clothing, cars, and healthcare costs have gone up for everyone, and people are struggling to stay afloat. And the last thing they should worry about is whether they're going to get kicked off of their healthcare plan. The mom working 2 jobs to support her children deserves healthcare. The caregiver making sure our elders are safe and healthy should be also able to see a doctor. We can and should look at containment costs, and we will. We're a smart enough bunch. We have 2 health chairs that are in the Latino Caucus. We can get this right. But we should not single out and sensationalize life-saving healthcare that serves our hardest working Californians. As the Latino Caucus has fought for decades, year after year, we will continue this fight even now. I'm grateful to the health, labor, and immigrant rights champions joining us today. They're on the front lines witnessing the real stories of our families. And now I'm here to introduce an incredible doctor, Ilan Shapiro, from Altamed.
Thank you for being here. My name is Ilan Shapiro. I'm a community pediatrician working in Altamed Health Services as the Chief Health Correspondent and Medical Affairs Officer. I do not want to go back to the moment that I was actually seeing complicated patients with asthma. I don't want to see las abuelitas that come to me with progressive problems with their diabetes. I do not want to go back. I have already seen it. I have seen the complications when someone actually could save a kidney and they end up in dialysis. I have seen our children, instead of having avoidable things, ending up in the hospital with horrible asthma. And that doesn't touch only the miracle of values. That touches everyone. Because at the moment that we are starting to roll back, we know that those children have something called parents. And those parents are doing absolutely everything to make sure that they are keeping their health in front, and also making sure that those kids, instead of actually getting worried about school, they need to be worried about intensive care unit, ER visits, and so forth. In my hand, because I have had the pleasure to work with a lot of community health workers, at the moment that we prevent someone of getting diabetes and we roll back all that stuff, that's an investment that we have from our entire community. Now, thinking that we're rolling back a lot of the things that we have done for years, knowing that yes, it's an investment, but knowing at the end we'll have a healthy community, a future for absolutely everybody, and also an amazing California. That's why I beg you, do not roll back to the things that we know that do not work. This at the front forward can look different and simple. On the back end, I don't want to see anybody else having a complicated diabetes case with a kidney failure, or my asthma kids actually ending up in the ER because we didn't have a doctor to see them. We didn't have a clinic to see them, or they were just afraid. That's why in our hands we have this opportunity. Familia, soy el doctor Ilan Shapiro, soy médico pediatra comunitario y funciono como jefe médico de asuntos para Altamed. Realmente espero y les pido que no regresemos a las cosas que ya habíamos hecho antes. Sabemos hoy en día, y con mis pacientes, que podemos realmente evitar muchas de las complicaciones que tenemos hoy. El asma es una de las cosas que veo mucho. Y justamente muchos de los niños van a regresar otra vez a cuidados intensivos y a emergencias porque no van a tener un acceso a salud. Y eso no es todo. También afecta directamente a los padres porque ellos, al momento de no ir a checarse por su diabetes, presión arterial alta, empiezan a tener complicaciones que nosotros podemos prevenir. Por eso es sumamente importante que cada uno de nosotros levantemos nuestra voz, que aseguremos que estamos conectando las cosas para que no regresemos a esos momentos donde los centros de emergencia era realmente donde podíamos ver a nuestros doctores, que los centros de emergencia era realmente donde algún tipo de doctor nos iba a ver por miedo, por indiferencia o por otras cosas que tenemos enfrente de nosotros. En nuestras manos está la posibilidad de continuar creciendo lo que hemos hecho, y quiero agradecer muchísimo las oportunidades de poder expresar lo que está pasando en mi comunidad y en mis pacientes. Gracias. And right now I have the pleasure to actually announce Senator Bonta. Please.
Good afternoon. I'm Assembly Member Mia Bonta. Thank you all for being here today. It is so incredibly important. I get to represent the beautiful people of Oakland, Alameda, and Emeryville, which includes La Clínica de la Raza, Asian Health Services, Native American Health Center, and West Oakland Roots Community Center. An incredible need as well. And I'm very honored to be able to speak with you all today. And it's so important right now that we're gathering to really understand what these cuts mean. These cuts to our budget, in our budgets, aren't just a question of dollars and cents, but real programs and services that impact up to millions of people, millions of our undocumented and immigrant community members that are being minimized and eliminated right now. Let's be real, 1.3 million Californians stand to get off of Medi-Cal should these budget proposals go forward. Hundreds of thousands of our neighbors, our community members, would be pushed off of Medi-Cal because of premiums that they would be exclusively required to pay. That's a two-tiered system. We cannot stand for that. I don't even think it's legal. We have decreased revenues for our federally qualified healthcare centers and our rural health clinics, facilities that are deep embedded in our communities, that provide culturally concordant care, that provide the care that our community members rely on and deserve. When they have less money it means that they are not able to serve as many of our community members. So that's a double hit, because we'll have our undocumented community members, our immigrant communities going to their local clinics and federally qualified health centers and will not be able to get the care that they need, as they are forced to try to pay for care that only they, exclusively because of some status qualification, are going to have to pay. And let's talk about the impact to our undocumented community members on long-term health care. We're talking about people with disabilities. We're talking about our elders, our seniors, who will not have the ability, they already don't get Social Security, now will not have the ability to have long-term health care. What will that mean? They will lose their ability to be taken care of in their homes and are more likely to end up on the street. We're not talking about dollars and cents. We're talking about real people. And at the same time that we seem to be willing to base a budget off of the backs of our undocumented community members, our immigrant community members, our Latino communities, our Asian communities, and our Black communities, we're also subsidizing a different kind of care. I'll just give you one fact. Last year, Walmart made $169 billion in revenue. That's the same corporation that figures out how to keep people half-time work so that they don't qualify for full-time health care. That's the same corporation that we are subsidizing. So what are we about, California? Are we about protecting our most vulnerable community members? Are we about ensuring that we have the ability to recognize that when our undocumented community members pay taxes, pay into this healthcare system, that we are going to deny them the right to be able to get that healthcare? But somehow we're going to be able to subsidize multinational corporations and the greed that they have by keeping people from being able to get the work that they deserve and the healthcare that they deserve? I'm Mia Bonta. I'm currently the Assembly Health Chair. We're about to go into a meeting, a budget hearing, where we're going to get to ask a lot of tough questions of the Department of Finance, of Health and Human Services, of CDSS over the course of this week. But the main question that will be behind every single question that we ask is, what are our values? What are the commitments that we already made? And are we willing to live up to the values that we've expressed to California? I, for one, am certainly willing to do that. And I will fight tooth and nail to make sure that this budget proposal goes to the scrap heap, and that we actually have the Department of Finance and the administration coming forward with realistic proposals that are not built on the backs of our community members.
Next, we have Jeanette Zanipatin, Director of Policy and Advocacy with CHIRLA.
Good afternoon, everyone. Thank you for inviting me to speak today. As you heard, the Medi-Cal proposals that the governor's proposing are going to have devastating impacts. My charge today is to give you insight into how those cuts are going to impact real community members. Again, my name is Jeanette Sanipatin. I'm the Director of Policy and Advocacy for CHIRLA. CHIRLA is one of the largest immigrant rights organizations here in the country. We have over 50,000 members that work directly with us. And we were fortunate to have our Advocacy Day last Wednesday, the morning of when these cuts were announced. And so many of our members had the opportunity to talk to legislative offices, to assembly members and senators directly, to let them know how these cuts would directly impact them and their family members. But we're not only looking at these cuts to, extending wait times for folks who are undocumented. We're also seeing these cuts impact folks who have U and T visas, folks who have domestic violence cases and have protection from immigration as well. And we're also seeing that these cuts will also impact folks that have DACA. These are long-term residents that have been here for many, many years in California, and we're really concerned about how these impacts are going to take across the board. So one such person who came to the Capitol last week was Irma Yaneth. She is 57 years old. She has lived in California and worked in California for over 32 years. Let that sink in. She has been here for 32 years, yet has never been able to access any of our state-funded benefits until recently. She is really concerned that as she and her husband both get older and do not have a safety net, that they will no longer have access to health care. She is really devastated by this proposal because she is currently has access to our Medi-Cal program for her diabetes and her high blood pressure. And so obviously she's concerned about not having access to those medications. But she also fears what these cuts would mean for other seniors like her and her husband, again, with no safety net. Her husband, also a long-term resident of California, who has also paid taxes, who's also worked here, has never had the benefit of these services, is also someone who is critically concerned about losing access to basic health care, about losing eye care, and about losing access to his dental care as well. But Irma and her husband are not the exception here in California, especially of those who would be impacted. Many immigrants in California have been here for over 20 years paying taxes, paying taxes as well. Immigrants also make up a large percentage of our workforce. Let's not forget that we're the 4th largest economy in the world, yet immigrants make up 19 million members of our workforce alone in our state. They make up about a third of our entire workforce here in the state of California. Immigrants alone have contributed $168.1 billion in both state and local taxes. Yet again, they are unable to access these services. We are urging the governor, we are urging the legislature to not adopt these cuts. They will have devastating impacts across the board. Again, it's not only for those that are undocumented, but those that have legal status as well in this country. And cutting coverage and benefit to these enrollees is just going to be short-sighted. It will contribute to poor health outcomes and increase healthcare costs for all of us. So we're urging the governor to not institute these cuts and to ensure that everyone has access to a safety net as they deserve to grow old with dignity and respect. Thank you.
Next, we have Oscar Munguia with the SCIU, Community Clinic Workers United.
Buenas tardes, me llamo Oscar Munguía. Soy un miembro orgulloso de SCIU Community Clinic Workers United, una campaña que une a healthcare workers de toda California. En nombre de todos los trabajadores de la salud en SCIU, incluidos los clinic workers de primera línea, me gustaría compartir cómo los desafíos a Medi-Cal nos afectan a nosotros y a nuestros pacientes.
Good afternoon. My name is Oscar Munguia. I am a proud member of SCIU Community Clinic Workers United, a campaign uniting clinic workers across California. On behalf of all healthcare workers united in SCIU, including frontline clinic workers, I'd like to share how challenges to Medi-Cal impact us and our patients.
En InnerCare trabajé como purchasing buyer durante 3 años en el centro California. Me sentí orgulloso de trabajar directamente en el frente, a cargo de comprar los equipos e instalaciones, supplies para todos los departamentos en nuestra clínica que necesitaba brindar la atención a nuestra comunidad.
I was a purchasing buyer for InnerCare in El Centro for 3 years. I was proud to work directly on the front lines in charge of the tools and equipment our clinic needed to provide care to our community.
Algunos de ustedes recordarán que InnerCare fue noticia el año pasado cuando despidieron a trabajadores por tratar de formar una unión. Yo soy uno de ellos. Clínicas como InnerCare son lo que se conoce como centros de salud calificados federalmente. Esto significa que dependen de Medi-Cal tanto como sus pacientes y las comunidades.
Some of you may remember that InnerCare made the news last year when they fired workers who were involved with the union. I am one of them. Clinics like InnerCare are what's known as FQHCs, or Federally Qualified Health Centers. That means they rely on Medi-Cal as much as their patients and communities do.
In my city, in El Centro, the 56% of the 56% del condado, o más de 100,000 personas, dependen de Medi-Cal para su atención médica. Y 1.3 mil millones de dólares en gastos de Medi-Cal ayudan a nuestra economía locales. No somos solo nosotros. Medi-Cal es un salvavidas de todo nuestro estado.
In my often overlooked corner of the state, 56% of the county, or over 100,000 people, rely on Medi-Cal for care, and $1.3 billion in Medi-Cal spending floods the local economies. But it's not just us. Medi-Cal is a lifeline across our state.
Es por eso que los Not Union Healthcare Workers y los trabajadores de la salud en todo SEIU han estado liderando la lucha contra Medicaid junto con nuestros socios de la coalición Lucha por Nuestra Salud. Hemos estado involucrados en la lucha por Medicaid desde el principio. Hemos estado en Washington, D.C., en las calles, y hemos estado en reuniones con el ayuntamiento.
That's why clinic workers and healthcare workers throughout SEIU have been leading the Medicaid fight back with our partners in the Fight for Health Coalition. We have been involved in the fight for Medicaid from the beginning. We've been to Washington, D.C., we've been in the streets, we've been to town hall meetings.
Se trata de mucho más que proteger nuestros empleos. Se trata de proteger a nuestras familias y a nuestra comunidad. Pensábamos que solo estábamos luchando contra la Casa Blanca y el liderazgo del Congreso. La semana pasada, con la publicación de la revisión de mayo, estamos profundamente decepcionados al saber que teníamos que luchar, que nuestra lucha nos llevaría aquí a Sacramento también.
It's much bigger than protecting our jobs. It's about protecting our families and community. We thought we were only fighting the White House and congressional leadership. Last week, with the release of the devastating May revise, we were deeply disappointed to learn that we had to bring our fight to Sacramento, too.
Me preocupa lo que pasará a mi gente, a los trabajadores de bajos ingresos, a los latinos, a los inmigrantes de nuestros condados rurales, si ya no pueden inscribirse en Medi-Cal o no pueden pagar un aumento de $100 mensuales para su cuidado. Sin Medi-Cal, las personas pospondrán la atención médica y terminarán yendo a urgencias.
I'm worried about what will happen to my people, low-wage workers, Latinos, immigrants in our rural communities, if they can no longer enroll in Medi-Cal or cannot afford a new $100 monthly fee for care. Without Medi-Cal, people would put off care and end up going to the ER.
Si la gente no recibe la atención que se necesita, seguramente sus condiciones empeorarán y podrían morir. Gobernador Newsom, no es justo perjudicar a los trabajadores californianos de bajos ingresos para equilibrar el presupuesto. Hay otra forma.
When and if they get the care they need, they will be sicker. People will die. Governor Newsom, it is not right to harm low-wage working Californians in order to balance the budget. There is another way.
Necesitamos proteger la promesa de atención médica para todos los californianos, independientemente de su edad, ingreso, raza, estado migratorio o código postal. Para lograr esto, ambos necesitamos cobertura a través de un programa Medi-Cal sólido que funciona para todos, y también necesitamos asegurarnos de que el dinero público invertido en clínicas llega a donde debe llegar, brindar atención de calidad al paciente.
We need to protect the promise of health care for all Californians, regardless of age, income, race, immigration status, or zip code. To do this, we both need coverage through a strong Medi-Cal program that works for everyone, and we need to make sure the public money invested in providers like clinics goes where it needs to go, providing quality patient care.
Quiero agradecer al Caucus Latino por invitarme el día de hoy. Me enorgullece mucho acompañarlos en nombre de todos los trabajadores de la salud, luchando por lo que es justo. Los invito a todos a unirse a nosotros para proteger el derecho de todos los californianos a la atención médica. Por su atención, gracias.
I want to thank the Latino Caucus for inviting me here today. I'm really proud to stand with you on behalf of all clinic workers fighting for what's right. I invite everyone to stand with us to protect every Californian's right to care. Thank you.
All right, and to close us up, we actually have a doctor in the house, Dr. Joaquin Arambula from the Central Valley.
Thank you, Chair Gonzalez, and I'd like to start where Oscar started if I can, because we have to make sure that we're centering what's occurring to those on the front lines who will be suffering from morbidity and mortality. There are many of you who know M&Ms and think of the food but aren't thinking about the pain, the suffering, and the death that comes from the actions that are being proposed. And so I'm grateful, like Oscar said, to be standing with the Latino Caucus that for years has stood up to increase access for health for all. From Chair Lena Gonzalez to Chair Sabrina Cervantes to Chair and now Speaker Robert Rivas to Chair Maria Elena Durazo to Chair Lorena Gonzalez, Ben Hueso, and Luis Ayala, we for years, if not decades, have stood up to make sure that we're expanding access. And so we have a responsibility here to make sure that we're continuing that good work. But while we've recognized CHIRLA and SEIU, we have not celebrated CIPC, Health Access, CPEN, many of the organizations that also have been fighting for years to allow us to get to this point here today. A budget is a reflection about values. And that means that we have to make sure that we're leaning in as the largest ethnic caucus in the entire country, right here in our state, to be emphasizing the importance of the policies that we are passing. Because what we do is larger than just our borders. What we do actually sets the tone for many across our country. Now, there's no mistake for why we are the tentpole for America's economy, and that is because of our immigrant brothers and sisters. I have the honor of coming from the Central Valley, where we would not have the bountiful harvest if it weren't for people waking up before the sun rose every morning. Before leaving their kids on their way to school to go to work, we have families who are building the roads, the skyscrapers, who are showing up to care for our elderly, who continue to work hard to move our economy forward, who during this pandemic we called essential, and yet we have moments where we treat them like they're expendable, where their lives are not valued the same as others. Now, as someone who spent my time in an emergency room, I didn't know the difference between human beings who came in and asked for my help. And here we're creating policies that sees and separates and treats people like they're different and like they're less than. And here in the Latino Caucus, we know that these are members of our community, they're members of our family, and they make our state better. Now, I, for one, am grateful to be standing with my sisters and brothers working here in La Lucha to make sure that we're moving our state forward, that this struggle that we have to expand access is not done by any one individual. It requires us all to roll up our sleeves. That while this began before I became in the legislature in 2015 with the expansion for all kids, to 2019 for young adults, 2021 for our elders and seniors, and just this last year in 24, all income-eligible adults will qualify for Medi-Cal. That this movement will continue past any one of us being here in the legislature as well. And so take it as your responsibility to carry this baton and to carry it with pride, and to know that we are only able to accomplish this if we work together. If we're able to realize that our strength comes in our numbers and our power. And so I'm here, Chair Gonzalez, to make sure you hear from each and every one of us that you have the Latino Caucus behind you. We're standing with you, and let's make sure that we deliver on our values, and that includes making sure that we're providing Medi-Cal for all income-eligible adults, regardless of their immigration status. Thank you for allowing me to join you today.
Right. So on behalf of the 38 members of the Latino Caucus, I want to say thank you all to the reporters and media that are here for being with us. On behalf of the vice chairs, Assembly Member Liz Ortega from Northern California and Assembly Member Juan Carrillo from Southern California, we truly thank you. With that, we'll open it up for a few questions, and I know our budget chairs, if they'd like to come up here, we can certainly answer as much as possible for you. So we'll start here.
You know, both the Department of Finance and the LAO now have done their analyses and pointed to cost increases, unexpected cost increases from Medi-Cal, including this expansion program, as the primary reason for the deficit that needs to be resolved here. So I'm wondering if you could speak to why you believe it's unfair to make changes to this program to address that deficit, and if so, what other changes, what other cuts or spending changes would you make in order to save this program?
Well, I think I would say, and we have our budget chairs here to touch on it a little bit more eloquently, but the federal government and who is in the White House should not change our values. And I think that's the issue we have here. We've known Medi-Cal for All was going to be expanded. We've been working on this for how long? 10 years? And now all of a sudden, because there's a new president in the White House, we now have to shift in our values, and we just don't believe that at all. Prescription drug costs, have gone up significantly. We have seen that. The Trump administration is working on that right now as we speak. We know that it has gone up significantly, and yet somehow we still get in this debate that immigrant communities are to blame. So I'm going to give you the bigger picture, but if one of our chairs would like to touch a little bit more on the specifics, I'd be happy to have you. On the out years.
1:30.
Yes.
We have a hearing?
Yeah.
We have a hearing at 1:30, Alexei. We're happy to talk about it.
And you can imagine every single process is where the priorities lie for the administration, and then we're going to counter with our priorities as well. But I would also note that even the LAO has also mentioned that there's no revenue, creation of revenues in these solutions. So as we come together in conversations, this isn't, some of the solutions that you're seeing are savings in the out years, not even savings in this year. So if we're going to be in this situation next year and the year after that if we don't do creation of revenues as well. So we're not saying that we need to create some cuts across our budget. What we're saying is the cuts that were made right now don't align with the principles of California. And so as we start the budget subcommittees today, you're going to see other suggestions. What you're seeing in here is other investments for small advisory councils, these long-lasting, decades-long IT programs that cost hundreds of millions of dollars into a black hole without any accountability. So we're going to come back to the table and say, these are other things we can cut. It shouldn't always be from the Health and Human Services section.
We're looking at a variety of different things, and I think the budget conversation will be very, critical to all of that. But we're looking at all across the picture of everything related to our budget. But we'll go here. We'll ask one question each, but then we'll come back over here.
Where we are asking people within the same category, if they have a particular immigration status, to not to have to pay premiums, while we are expecting others to continue to not have to pay that. I believe that that's a question that we should raise in terms of the level of constitutionality around that. I am not a lawyer, but I did go to law school and know the basic tenets of the Equal Protection Clause, and I believe that that is something that needs to be looked at to see whether or not it's a violation of the Equal Protection Clause.
Yes, we'll go here and then we'll go here. Sure. That's not exactly true. And I think what we're saying here is we don't want this to be solely the narrative that it's just the immigrant community and it's just the undocumented community. There are a lot of issues here. What does UIS mean? Unsatisfactory immigrant status? Right now, anyone. We see folks on the streets getting kidnapped from the federal administration for having legal permanent residence. Student visas being revoked. We don't even know what that means. So let's get clear on that. And again, prescription drug costs are significantly higher. We're not even talking about that. I would ask and implore the media to please talk about that. Please. Because these drug costs across the board, whether you're an immigrant or not, are skyrocketing for every Californian, regardless of immigration status. So we are very, very, we want to be practical and reasonable about our budget. And I think your question is a good one in terms of we got to look at it across the board. Why is it always on the backs of these folks that give $9 billion to, in most cases, into the Medicare system too? And yet they're not receiving anything back. And now that we're saying let's pull back on their healthcare also. So we've got to assess everything. We're saying we've got to be reasonable about this approach. We have to stop the narrative on vilifying immigrants. we're going to look at everything. And it's not just for this caucus. I think everybody else, even outside of this caucus, is talking about that. We have to look at every approach and be very creative on what it could be. I'm not saying specifically tax increases, everything. Yes, ma'am. Yeah, I mean, again, we want to get the real costs. I think what we've seen are sort of preliminary costs that have really been changing too. Quite honestly, we need the real costs of what all these mean and the savings. Right now, there are no savings to be able to put a freeze on the 19 plus demographic. It's on the out years. So we need to be very real and very clear at what the savings are now, what the out years will look like, what the potential costs, not just now, but down the road. And so we're assessing all of it. It's hard to say, but we really want to ensure that we are keeping a hard line on, I would say, we don't want to freeze folks. We don't want to kick folks off or disenroll them off of healthcare. And we need to look at other ways to balance our budget outside of Medi-Cal. Yes, please.
I just want to add, this isn't about specific issues in our budget. We know how to do that. We know how to do that as legislators, and that's why we're going through this process. This is about doing something that is illegal, to identify and discriminate against a certain group of people to fix one piece of the budget. That is wrong. That's what we're talking about. Don't go there. Don't do that. It's a big mistake, and let's fix it another way. The way that we know how to do it, which is doing it legally, not doing it illegally.
Okay. I think that's it for now. We've got to wrap up because I know many of our health chairs have to get back to a budget sub, but we want to thank you again. Thank our stakeholders who are here and all of the senators, the doctors, and everyone out there, in media land. We appreciate you too. Thank you very much. Stakeholders who are here and all of the senators, the doctors, and everyone out there.